Well, Dr. Parik Pilly is an internal medicine specialist at a hospital in New York City. He joins us live now via Skype. Thank you for joining us on the program. What's the situation you're seeing at your hospital? What are you seeing in the ED and how are you coping?
I came across information maybe a month ago or so that really had a lot of the very accurate information about this virus, recognizing this as a pandemic long before even the WHO had, and knowing that the casualty numbers were underreported. And I think a big part was that the asymptomatic carriers were very contagious. These sources knew this much before then, I guess either the WHO or CDC. I think with the information, the source being very accurate, one thing that really stuck out to me is that, and I try to, tell my colleagues and everybody how contagious this was, that you needed Ebola level equipment like hazmat suits, respirators that purify the air, meaning that, the big contention is this droplet or airborne? And clearly we're seeing some airborne component because this is how contagious this disease was, and it was spreading. And unfortunately, it's been affecting hospital healthcare workers and such. This source has been accurate in other things, and I saw it, and I was like, wow, this is kind of scary. It says don't travel in airplanes, don't be in crowded areas, don't take mass transport. It's like, why is that? And this virus gets airborne in some way in closed ventilation spaces like subways, mass transport, and especially hospital floors. We need facilities that are only COVID only, because the level of equipment and protection for our healthcare workers needs to be at that level. I think you've seen videos out of China and Italy. They're wearing like spacesuit level stuff. And in order to do that, you need to have a dedicated facilities, dedicated basically hermetic style quarantines, right? Space that you need negative pressure ventilation. You need sliding doors like they see in Star Trek, right? It seals it because this thing is so contagious, it gets out, that you can breathe it in, you can take it in your eyes, all these sorts of things. And I think opening economy too soon, the other update they had given me was that, we need to continue this for several more months, at least 3 months to even 8 months, because if people go too soon, if you go back, this is gonna come in waves and it's getting more virulent, more mutations, it's affecting newborns, it's affecting younger people. You're not going to have an economy. No one's going to want to go out. The virus loves crowds. We haven't seen anything like this in more than 100 years. I would say forget the Spanish flu. We need to create separate, hermetically sealed quarantines for these COVID patients, so then we can have healthcare workers not get infected, wear the proper PPE, maximize efficiency, watch these people for much longer than 2 weeks. The incubation period is supposedly up to 1 month to 3 months. What's happening is the healthcare workers are probably carrying it, getting infected, and taking it home to their family, and then that's spreading it around. And on top of that, asymptomatic spreaders. That's huge. That wasn't what the flu was, right? They kept saying in Italy, this is not the flu. That's the spread. And actually, they even, in this source, said that the kids were the highest, the great hidden spreaders of this virus because they were largely immune initially. And then they were spreading it all around, unknowingly, innocently. But this is the insidiousness of this virus. We need macro policy, and we need that hermetically sealed quarantine space and treatment centers for COVID. So we protect the workers, and we help these people and monitor them, and don't allow the spread to occur.